Well, without further ado, I like to keep things on time. So we are going to go ahead and get started. Welcome everybody to the 2024 second webinar in the webinar series for the Virtual Horse Management webinar series. I'm Dr. Carrie Williams. I'm your host tonight. I am the Equine Extension Specialist at Rutgers University. I'm also the Associate Director of Extension for the Equine Science Center. So welcome. I love having virtual webinars because I know last week's we were on a snow day and everyone could still be there. This week I'm getting over a cold, so pardon me if I cough a few times. I'm also really going to try to keep myself on mute unless I'm absolutely needed. So please. And yes, for everybody who's wondering, you are all on mute. So you can make as much noise as you would like and we won't hear you. I even had someone ask last week if they could start cooking. Absolutely, please do. So we will not be able to hear you. The only way you can communicate with us, again, is if you have any IT problems, use the chat. You will only see, or only the panelists will see your chats. If you have any questions for the speakers, today we are using that Q&A box. So go on the bottom and you'll be able to type your Q&A. I've also had a couple questions about recording the webinars and if you're able to watch them later. We are recording them. We are going to record the entire series, and then a month after the series, we're going to post them on the Equine Science Center's YouTube page. So if you are registered, you're going to get an email saying that they are now live and posted and where to find them. So you can look forward to that. But we really love your live interaction. Now we've got some great speakers and some great topics. So now that I have introduced myself, I would like to know just a little bit more about all of you before I introduce the Equine Science Center and our speakers. So what I would ask everybody to do, and this is kind of fun, and even if you did it last Tuesday, please do it again because every day I have a new day. You're going to go to menti.com, menti.com. And once you all get there, I'm going to have Kyle put in the chat box, and then I'm going to read off some numbers. And I have a couple questions for you just to get to know you. So I'm going to share my screen and go to Menti. So when you are on Menti, you can go to the numbers that Kyle has put in the chat. And as soon as my share screen goes away, you'll be able to see the numbers because unfortunately I'm not able to get to the numbers right now. Where are they? Come on, go away. Yep, people are starting to see the numbers, but they were 9228, 8829. So what I would like you to do, and it was very important that you read the first thing, and someone didn't read the first thing, do not abbreviate. Do not abbreviate. Okay, the reason why I don't want anybody to abbreviate your state or your country is because that way it's not going to put all the like answers together. So what we're seeing right now is that Pennsylvania is the biggest word. So therefore that means that Pennsylvania has the most people on the call or the most attendees. We're followed very closely by New Jersey. New Jersey is also up and running, but we also have Maryland and Virginia, New York. We've got a couple of those words getting bigger. So if you were to abbreviate Virginia, you're not going to be counted with all the other Virginias. So that's the only reason why we say do not abbreviate. So the number to enter again is 9228 8829. So 9228 8829. And I see we have 73 people on Menti right now, but I have about 179 participants. So I'll give you guys a little bit longer to log on. I love watching all of these change and turn. And I also love to see how many states. Once upon a time, I believe it was our second webinar series, we had 38 states. So it was great. We had that many states, and we also had a bunch of countries. So right now, if I can look between the words moving, I see Russia, welcome from Russia, Portugal, welcome, Spain, awesome, very excited. We even have Alaska. I want to say this is probably the first Alaska state we have seen. So welcome and thank you for joining us. Saskatchewan, Again, they're moving so quickly. Sometimes I lose the word that I was looking at. But again, we have Pennsylvania and New Jersey as being our top two, with looks like Maryland, New York, Florida, Michigan, Virginia. They're kind of all up and running. We have Ontario, Canada. Awesome. So you can continue to log on and continue to answer this question. I'm going to go to the next question, but please continue to log on. This will change in the background as I move to our next slide, because the next slide is what I want to know what your primary interaction with horses is. And actually, I'm going to allow 3 answers. So for instance, if you're primarily a barn manager, but also own your own horse, you can pick both of those. Also, if you're a veterinarian, but you also own your own horse, you can answer one of those. So you can answer up to 3 different things, but primary interactions. And obviously, I know we're all horse enthusiasts, otherwise we wouldn't be here, right? So I like to see these change. I know we have a lot of horse owners. We got about 56 horse owners now. We got a couple, and if you're other, so I do see there's other, I'm actually going to open up the chat box. Go ahead and chat and tell me what other you are. I know other is sometimes either, I've seen PATH certified instructors. I've seen, oh, yep, and there we go, a PATH instructor. I've also seen, there's a veterinary technician. Awesome. Thank you. More PATH instructors. Equine sports massage therapist. That's great. Awesome. We've got some more horse owners. Therapy barn owner. Great. So we've got quite a bit of other, and I know it's really hard to actually have everything put in one chart. So I kind of pick some of the top things. We even have a couple other veterinarians on there. So welcome. Volunteered at an adaptive riding stable. Great. Massage therapist. Awesome. So thank you. I'm going to go back. I want to go back one and just see if our countries have changed at all, because right now we have 110 people on, and I see we have 200 participants. So most of you are joining us. So thank you again. And we're still changing. We're still adding numbers. Let's see. I'm going to take another quick look. Got quite a few states. I'd love to do another state count again, but Louisiana, Washington, all the way to the other coast. So that's awesome. And Alaska, I'm still fascinated. More Ontario. Excellent. Well, thank you all for joining us, and please feel free. You can continue to fill this out, and this will change in the background. But what I'm going to do now is I'm going to pull up a different kind of slideshow, and tell you a little bit more about our Equine Science Center. So again, this is the 2024 Virtual Horse Management Seminar. This is day 2. Never fear, you do have one more webinar, and we do have them recorded. So what I want to do, we're going to go through a little bit of a video, and you can learn a little bit more about what the Equine Science Center does here at Rutgers. So I'm going to stop talking for just a minute.
Good morning. Welcome to the George H. Cook campus, home of the New Jersey Agricultural Experiment Station, the School of Environmental and Biological Sciences, and of course, home to the Rutgers Equine Science Center. Equine Science Center is a soft-walled center where we bring together the best and the brightest to solve challenges impacting horses, horse well-being, and the horse industry. To provide you more details about the research being conducted at the Equine Science Center, and specifically the Equine Exercise Physiology Lab, I'd like to introduce Dr. Kenneth McKeever.
The lab was founded in 1995, and since then it's been one of the most productive research labs in the country, if not the world. We've conducted studies looking at how to care for the aged horse. That's a horse that's over 20. We've looked at various drugs that affect performance. We've even done studies for the Army looking at food extracts that can reduce inflammation. So the Equine Science Center and the Equine Exercise Physiology Lab are a valuable asset to how we care for horses in the state of New Jersey.
So we've all visited this morning the Equine Exercise Physiology Lab, part of the Equine Science Center at Rutgers. We have another facility where cutting-edge research is being carried out, located on Riders Lane, and it is the site of the first of its kind environmental best management practices demonstration horse farm, located here on the George H. Cook campus. The team of scientists who are helping horse farmers become better environmental stewards and caretakers of the land is a team of multidisciplinary faculty, students, and staff led by Dr. Carrie Williams, Dr. Mike Westendorf, PhD student Jennifer Weinart, and other faculty, students, and staff from different departments here at Rutgers and beyond.
Hello, I'm Dr. Carrie Williams, the Equine Extension Specialist here at Rutgers University and the Associate Director of Extension for the Equine Science Center. We are here at the Environmental Best Management Practice Demonstration Horse Farm. This serves as a wonderful venue for the public, farm owners, other industry professionals to come look and see the 8 various best management practices, educational venues that they can use on their farm or in their areas. It is open to the public. You can come anytime. This venue also serves as a great location for research. My current graduate student, Jennifer Weinart, is looking at both cool season and some novel warm season grasses to see the production as well as the horse's metabolism. Some glucose and insulin responses as well as the microbiome will be looked at over the next 2 years of this project. Thank you for visiting all of us at the Equine Science Center. Our website can be found at esc.rutgers.edu.
And so with that, I just want to share a couple of our research projects that the Equine Science Center has funded this year. You can read them on your screen and you'll be hearing more about them if you have subscribed to some of the information that the Equine Science Center is putting out. Where you can find that is on our website, but we would also love it if you enjoy your programs or you enjoy hearing about the research to please consider giving back to the Equine Science Center. You can visit the donate page on the Equine Science Center website. No donation is too small. We appreciate anything that you can do to help us care for our horses and enjoy the research and everything that's going on at the center. So with that being said, I am going to remind you one more time, because we have a few more people on the webinar, that if you do have a question for the speakers, I'm going to be monitoring that as we go through the evening. So please type them into the Q&A box down at the bottom of your screen. Any of the chats are only going to go to the panelists, and they're just for any IT problems or any issues you're having with the webinar. So please keep most of the bulk of the questions in the Q&A box, because that's what I'm going to be taking questions from. So without further ado, I'm going to go ahead and introduce our first speaker, and I would ask Dr. Martin to go ahead and pull up her information and her slideshow for us. So I am really thrilled to welcome Dr. Jessica Martin. She's a veterinarian at Mountain Pointe Equine, and that's in Hackettstown, New Jersey. Dr. Martin is a South Jersey native who grew up riding and competing horses from a very young age, and she always felt at home in a barn setting. She is one of our Rutgers alumni. She graduated from the School of Environmental and Biological Sciences, where she studied with us in the Animal Science Department and got her pre-veterinary degree in 2013. During her time at Rutgers, she was taught by Dr. Fergaro in a course entitled Advanced Equine Healthcare and Management. Dr. Fergaro, so you know, just happens to be the owner of Mountain Pointe Equine, and he served as her mentor throughout school and as she pursued her veterinary degree. Dr. Martin then attended Ross Veterinary School and graduated magna cum laude in 2017 with her DVM. She then followed graduation and did an internship at Mid-Atlantic Equine in Ringgoes, New Jersey. She then joined Dr. Fergaro at Mountain Pointe Equine as its first veterinary associate in the July of 2018. She has a particular interest in lameness, endoscopy, and neonatal care, but in her spare time, she enjoys spending time with her family, practicing yoga, hiking, her dog, Toby, and she has recently turned to competitive riding in the National Reined Cow Horse events. So without further ado, please take it away, Dr. Martin.
Hi, everybody, and thank you for having me. I'm really thrilled to be back speaking for Rutgers because Rutgers is very near and dear to my heart. And we did a in-person session of this. I guess it was 2 weeks ago now. But I'm just happy to have be able to speak with all of you in the comfort of your own homes. So today we're going to talk about veterinary care for the senior horse. I usually would ask all of you, how many people have horses over 20, and I'm sure there's many of you in the crowd there. But for interest of time, I'm going to try to keep us on task as much as possible. So we'll just go right into it. So when we talk about the senior horse, the biggest thing that we look at as a veterinarian at the horse as a whole. But I kind of like to break it down into body systems to make it just a little bit more straightforward and to make sure we're addressing all of the body systems that we have to consider with the senior horse. The first one being the digestive system, the second being the dental system, the third being the musculoskeletal system, and the fourth being the immune system. So all of these things can change as time goes on, as the horse ages, and there are things that we need to keep in mind specifically for the senior. So first, we're going to talk a little bit about the digestive system, and I'm not going to go into too much detail because Dr. Liburt is going to speak with you specifically about senior horse nutrition, and she has a very in-depth discussion, and I don't want to steal her thunder by any means. But just something to think about with your senior horse is that the digestive system can be compromised during aging, and this can lead to weight loss. That's probably our most common, clinical sign that we are reported as veterinarians with the aging horse. Like this horse doesn't loses weight in the winter or just doesn't maintain weight as well as they had prior. And horses that age, they can have altered absorption, and usually this isn't necessarily because of the aging process itself, but there can be different things like parasitic scarring. So basically the parasites that they've maybe been exposed to in the past, there might be scarring in the intestines, or their teeth or dentition can be affecting their absorption, whether they can absorb all of those nutrients. We also, when we are looking at a senior horse, we have to see if there's any other concurrent diseases going on. So one thing that we sometimes can see as horses age is inflammatory bowel disease, and it's similar in humans where basically there's inflammation within the gut, and the horse cannot then basically absorb the nutrients normally. Something else that we have to keep in mind is neoplasia. So one of the most common GI neoplasia that we can see in horses is lymphoma, but overall cancer and neoplasia in the GI system of horses is pretty rare. It's about 2% of all of the cancers that we see in horses. So it is pretty rare, but it is something that we have to keep in the back of our minds, and we can do biopsies and things that can kind of show whether there's a suggestion that might be going on with the horse. Something else to consider with horses that are aging is that we have to ensure that the horse is receiving a high quality diet that meets the individual needs of that own horse. So I can't give you as a veterinarian a cookie cutter recommendation that says, this is what you should feed a senior horse. Every horse is different in what their needs are. Every horse has, different caloric needs, different needs for protein, fat, and fiber. But all of those things are very important to keep in mind as your horse ages. And consulting with a nutritionist would be a great start if there's anything, any concerns for meeting those needs. And then if you have concerns about your horse maintaining weight, consult with your veterinarian. Sometimes we can do blood work, which can basically rule out any systemic causes of weight loss. And then also, again, a nutritional consult is a really great resource that you can take advantage of to then guide you in the appropriate feeding of your horse. So I just put this in here, and Dr. Liburt might talk about it a little bit with you guys as well. But body condition scoring is kind of how we like to record in our medical record system, basically the amount of fat cover that the horse has on their body. So it is a good way to kind of monitor the horse over time. And basically our ideal weight would be about a 5 out of 9. So it's a scale from 1 to 9, 1 being a poor condition and 9 being extremely obese or fat. So a 4 or a 5 would probably be our general rule for what we would consider a good weight in a horse. Some of the, show horses, they want them to be have a little bit more weight on them. So sometimes a 6 would be what would be considered normal, but this is something that we can do in order to make sure that we can monitor how much fat they have on their body. Weight tapes are another way of actually measuring on the farm and kind of coming up with, and something that we can follow over time. I wish that we had scales on every farm, because that would be great. We could just walk the horse on the scale like you do at the small animal vet, and they record the dog's weight and then say like, oh, they've lost 5 pounds or they've gained 5 pounds. It's not as practical for us in the horse world. So this is something that we have at our disposal that we can use and monitor and track. And it's something that's important as your horse ages. So I'm sure some of you have seen this before and maybe are familiar, maybe your own horse has had some signs that are consistent with this. So this is very common for us to see and have questions about in the winter. It's basically, free fecal water syndrome is basically a syndrome where the horse develops liquid manure, but has normal fecal balls, and then either passes liquid before, after, or during the process of passing manure. The differences between this and diarrhea is that they're not clinically sick. So the horse has a good appetite, is otherwise normal, there's no concerns for a fever, anything like that. And these horses just have liquid running down their hind legs, and we typically see it in the winter. And as horses age, this can become an issue for them most of the time because of a consequence of the inability to digest long stem fibers. So when I say that, I mean basically hay. And so hay has longer stems as compared to something like a hay stretcher, hay cubes, pellets, and even grass. So sometimes as horses age and they maybe don't have as good of dentition where they can chew those longer stems into smaller fibers where they can actually absorb, a lot of these horses, we end up actually removing some of the hay from their diet and replacing it with a different source of fiber. And a lot of these horses do well with that. Some horses do need other interventions and other medications. But it is something that we commonly see, and sometimes it would be good if you see this within your horse to consult with your veterinarian or a nutritionist to see if there's anything that they can alter in the diet to kind of help along with that and preventing these findings. So along with the digestive system, we have to talk about the dental system. Dentistry is a passion of mine. I do perform several hundred dentals a year on horses, and horses themselves, we do recommend getting a dental exam at least once a year, especially our geriatric or our senior horses. Horses have hypsodont teeth, which is basically meaning that they have high crown teeth as compared to, say, our teeth. And these teeth continuously erupt with aging. So basically that means that if you see here on the picture on the right-hand side, you can see that there's a very long root that's up within the maxilla or the mandible, and it's erupting over time and wearing as the horse chews. So the part of the crown that we see on in the inside of the mouth, outside of the maxilla or the mandible, is called the clinical crown. And that's what we can see when we do our dental exams. And what we see kind of where that bone has been cut away is the reserve crown. So that's what crown has been left over as it erupts. Now, horses, as they erupt their reserve crown, eventually they run out of reserve crown. And this can eventually, the teeth can expire and essentially not become useful anymore. And I'm going to show you a few pictures of that coming up. But this is how, once as the horse ages, we have a nice long root there that eventually is no longer useful. So after we have a dental exam once a year, which we recommend doing with a sedation, a full mouth speculum, which opens their mouth, a light, and a mirror to look at the surface of every tooth. We do recommend, based on what we find on the dental exam, the floating, which is just reducing any points that we might see, and then equilibration, which is just correcting imbalances within the mouth. And these imbalances can happen more frequently with senior horses than other, say younger horses. So this picture on the right-hand side, this is a horse that was about, I want to say during this photo, it was about 39 years old. So he, as you can see, all of his teeth are kind of worn down to little nubs. So this horse lived to be about 43, it's a quarter horse. And we maintained him, and he was like a body condition score of a 5 out of 9, and very happy eating a very large mash of different soaked forages and senior feed throughout his life, as he, once he was up in that age bracket. And he ate that several times a day, and he was very, very happy. But this is an example of loss of clinical crown, so complete wearing of the teeth until they're out of occlusion. So he no longer has a grinding surface to use for his teeth. Other common issues that we see in senior horses is periodontal disease. So periodontal disease, just diseases of the gums. They can get feed that kind of packs in between their teeth. We often see fractured teeth in older horses because of basically excessive wearing and, breakdown of that tooth. And then if we have missing teeth that have either been extracted or have fallen out, then we may see abnormal eruption of the opposing tooth on the bottom of the, basically, below that. These horses may require more frequent dental care. I often hear people say that their horse no longer needs to be seen or floated or evaluated because they're older and they're not working. I disagree. I would say that most of the pathology that I find in equine mouths are in senior horses, and I would recommend them actually being monitored more often. They may or may not need to be floated, or but dental exams are very important for them to be continuously done and kept up with. So I just put some pictures in here because we talked a little bit about the things that we can find on a dental exam. So on the left-hand side, this is one of the horse's molars, and there's a pretty large fracture just coming right down across the tooth, and we can see that there's a displacement of this fragment towards the palate. This is the palate, that's the tongue here, and this is the cheek. So this tooth required extraction. You can see there's some food packing up where the fracture is, and the gums are unhealthy. So this was a rotten tooth that had fractured. So this tooth was extracted and the horse did well. This here on the right-hand side, this is basically what we call a diastema. So basically this horse has periodontal disease, and this is basically a valve-shaped opening where food can get stuck, and this is common to see in older horses. And so what we do sometimes to address these is we actually open these, we've widened this valve, and we allow food to come in, but it can also come out and doesn't get trapped and kind of sit in there. So it's just something that we can see often in senior horses and need to address it at the time that we see it. So this horse here, this horse was about 36 when I saw her, and she, she had basically been losing weight, but hadn't had a dental exam in maybe 6 or 7 years. When I actually went in after looking for my initial exam, I said, wow, she has all of her teeth. That's surprising, but all of these teeth were loose. I stuck my hand in there and I could actually pull them out just with my hand. So they were just sitting there. in the socket. So definitely important to get a dental exam. I'm actually going to show you a picture of this horse later. But this is something that it's very important to get regular dental care, because obviously this horse was uncomfortable from having these loose teeth and needed them to be extracted. So another disease that I'm just going to mention and talk about a little bit is EOTRH. And I don't know if anybody of you have heard of this disease before, or if you've had a horse that's been affected by EOTRH. It's kind of a newer disease that we've been diagnosing more. I don't necessarily think that it's newer, but we're just looking for it more, and we're a little bit more educated. But this is a disease of the incisors, so the front teeth and the canine teeth. It can affect the canine teeth. And what it stands for is equine odontoclastic tooth resorption and hypercementosis. This is a painful condition of the incisors in the canines, and it is gradual in its onset. So over time, we can see a horse with, say, normal incisors, and then we can start to see signs of this disease. And what happens with this disease is that the roots actually start to disintegrate and resorb, and the teeth can become loose. And the adjective that we use is hypercementosis. We see hypercementum, which is a portion of the tooth that's trying to basically stabilize. So if you see this white area around the tooth here, this is the cementum that has been laid down by the body to try to stabilize these teeth. Now, this is a painful condition, and horses tend to just have kind of low-grade chronic pain that progresses over time, and until it gets to the severe EOTRH, in which these horses are pretty sensitive on their front teeth. So here's another example of a horse with EOTRH. You can even see above this incisor here, there's a little bit of a draining tract. So there's been an infection in this root. You can see how the gums are just kind of receding around these roots. And this horse's teeth were slightly loose, but not, not immediately able to extract. We had to actually extract them. So what we see is resorption of the root, overproduction of the cementum, loose and painful incisors. They can get secondary infections and fractures at the root. And so something that you can do at home if you have a horse and you suspect this is the carrot test. So I recommend having one of those really big carrots, and asking your horse to bite the carrot using only their front teeth. And if they're able to bite that willingly and they don't avoid it, then it may be suggestive that they don't have significant incisor pain. But if a horse is actively avoiding using the incisors, it could be suggestive of incisor pain. Now, obviously, the only way to really diagnose this is having your veterinarian out to do an oral exam and look for these, subtle signs that we're seeing as they age. And then the only way to really confirm a diagnosis is to perform radiographs of the incisor. So this is a horse that I radiographed, and we can see this is severe. This is actually a pocket of pus that was sitting behind these 3 incisors. And you can see that there was resorption of the root, and even these roots became kind of blunted. So we ended up extracting all of these teeth, and the horse did great. So extractions improve quality of life. It is not something that we want to do, is to go and pull all of your horse's teeth. But that is unfortunately the only treatment that we have right now, because we don't really know what causes this disease. We're trying to, find the answer to that. And if we can eventually find the answer through research, then hopefully we can prevent it and or treat it. But as of this moment, all we have is to extract the incisors to take away the source of pain. So this is a horse that had all of his incisors removed. You can see his tongue's kind of hanging out. This is kind of how they look. They do very well. They actually start to pull the grass with their lips. All of the gums have healed over the extraction sites, and the only thing that some owners don't love is that their tongue hangs out. And when horses are just standing there, usually their tongue will hang out. But if they're being ridden or something like that, they usually will actually actively hold their tongue in their mouths. This is a horse that was about a week after extractions. loving life. I don't, this video wasn't really taken specifically for this purpose, but you can see he's out there in the field looking super happy. He gets up to graze and then the video stops, but he was having no trouble grazing whatsoever. So it's just something to keep in mind. If your horse has been diagnosed with this disease, it is the only treatment that we have as of now. Let's see here. Okay, so we're going to switch gears now. We're going to talk a little bit about the musculoskeletal system. So in aged horses, we have to consider osteoarthritis. So this is a cause, probably the most significant cause of lameness in horses in general, especially aged horses. And this is a consequence of a horse's occupation and or conformation, plus the repetitive impact to joints. So this can progress to end-stage arthritis and become debilitating for quality of life. You can see this horse in the picture here has significant bony proliferation within the carpal joints or the knee joints. And these horses have decreased range of motion. They can be painful and it can be hard for them to get around. And it can sometimes be the reason why we have to eventually talk about euthanasia. But some of these horses rely on long-term therapies for comfort, such as joint injections, joint supplements, and or NSAIDs such as Equiox or Fercoxib. This is just a depiction of how arthritis kind of progresses over time. So on the left-hand side, you see a normal joint with a normal synovial membrane that is mobile and flexible. You can see the joint space. There's fluid within the joint that is healthy, and there's healthy cartilage. And as time goes on, basically that synovial membrane will become more rigid. The joint space will narrow. The cartilage will become thinner until there's eventually loss of cartilage completely. The joint space is very narrow, and you have a bone-on-bone kind of motion, which is very uncomfortable for the horse. Here is just some radiographs. This is not the same horse, but I just wanted to show you the difference. So on the left-hand side, this is a young 4-year-old quarter horse. And you can see his joint. This is a picture, just a radiograph of his foot. But here's the coffin joint, and the pastern joint, and then up here's the fetlock, but you can't really, that's not really visible. And then here is a horse that is 28 years old, quarter horse with chronic pastern arthritis. So this horse is lame at the walk and is managed basically with pain medications and NSAIDs, and obviously shoeing and everything to keep him comfortable. But you can see this is the pastern joint here, where you could see a nice joint space. There is absolutely no joint space. There is bony proliferation, and this is basically a fused pastern joint. So just the difference on radiographs. These are things we can find in our older horses. So this is the horse that I showed you earlier with the teeth that had been extracted just by sticking my hand in there. This is Terry. She was kind of my weekly call that I got here for a little while. She had a tendency to try to lay down on the edge of a hill, and she would get stuck with her legs facing up the hill and then couldn't get up, and we would have to come and flip her over, and then she would just get up. So this mare she was in her 30s, and she was a standardbred, very tough horse, and really didn't like vets very much. So she would see our truck coming and like already be snorting as she was like laying on the ground. But this, recumbency is something that we see commonly in older horses, and it can be a result of arthritis, neurologic disease, or weakness. Some horses might be having an episode of colic and get stuck laying down, or it could be trauma related. So, a fractured leg or something like that. But older horses are generally weaker. They have less muscle mass and less ability to lift themselves up. So in Terry's case, we were able to just, flip her over and get her into a position where she could get herself up. And then she would get up and then run away from us promptly. So she was an interesting one. Ultimately, her owner did decide to put her down after, I would say it was probably about 6 months of doing this, several times a month. So it became just, for quality of life reasons, they decided not to put her down and have have her just not have that kind of stress. But this is more common for these guys on slick surfaces such as mud or snow, ice. We've been having a lot of snow and a lot of mud lately, so it's something to consider when you have your older guys. Just knowing how the footing is for them, that can be important. Other treatments that we do. This is a picture of a horse that actually has some neurologic symptoms, that was getting his hind feet trimmed and then went down as that was happening. And we ended up, the owner had called the fire department. So we had run him some fluids, given him anti-inflammatories, and we were able actually to assist him to stand using a, like basically a, a lift that we were able to get underneath him. So again, it just depends on the case. This was a successful case. As soon as the horse was up, he walked to his stall, and he is still, knock on wood, doing well. And it's been about probably 2 years since then. So it's one of those things where we just have to assess the situation as a vet and kind of help to decide whether, this is going to be successful or not. Some horses that have been down do not ever try to get up and do not have the strength to actually get up, and recumbency is not compatible with life long term. So the longer that they're down, the worse the prognosis it is. So again, we have repeat offenders. We do discuss quality of life, and again, euthanasia is something that we have to unfortunately consider when we have this happen continuously. So another really common disease, and I'm sure many of you have heard of this or maybe have a horse with PPID, or as often referred to as equine Cushing's. So the equine Cushing's is kind of an older term. The reason that we don't call it equine Cushing's anymore is that it differs from the human and the dog, and that's just in the location of where it happens in the pituitary gland. So we like to call it the pituitary pars intermedia dysfunction, and that is PPID. This is the most common endocrine disorder in horses, and it is an enlargement of the pituitary gland in the middle lobe. And this is usually due to it being overactive. It's not truly neoplastic, meaning cancerous, but it is a progressive disease. It usually happens in horses over 15 years of age. We usually see it in horses over 20, but we have had it reported as early as 5 years. So you can see this horse on the right. It's kind of our poster child, but I'm going to show you a little bit more of our clinical signs in other horses. So this is basically, when I think of Cushing's, this is the type of horse that I think of. So we see a horse with long hair coat. Sometimes we can see muscle atrophy, and these are a rounded abdomen. Sometimes we even see tendon or ligament laxity or breakdown of those ligaments, increased drinking and urination, and exercise intolerance. But what I want you guys to remember is that these are advanced clinical signs of Cushing's or PPID. I also want you to be aware that this horse on the left-hand side also had PPID, and does not look like the horse on the right. So there can be some very subtle early signs of PPID that can kind of, tip you off to say, like, maybe my horse might have this. So early signs would be delayed shedding. So this is actually my horse here on the left. And the first sign that I had seen was delayed shedding. So just the shedding pattern had changed from his normal. Decreased top line. And again, it's hard in the senior horses that are retired because they aren't working. So we expect some of that. Tendon or ligament inflammation. So not necessarily breakdown, but maybe there's a chronic tendon problem or a suspensory issue or something like that. Change in attitude or lethargy, and then poor performance. So these are kind of differences between the early and the advanced signs, and just be aware that it can range. We also see kind of secondary signs associated with PPID, so chronic infections that aren't getting better or aren't responsive. Repeat hoof abscesses, horses that either have multiple hoof abscesses or ones that don't heal well. Laminitis is a really important one. And then delayed healing. And then the last one is infertility. And that's one that maybe not everybody thinks about right away, but it can affect their fertility as well. So I'm going to share this video because this is going to explain to you guys how PPID works, and it's better than I can explain it. So this is a really good video. If I can get it to work.
To understand what causes PPID, it's necessary to understand how a healthy equine pituitary gland functions. The pituitary gland, known as the master gland, lies at the base of the brain. It is responsible for the production of an array of hormones. These hormones then circulate throughout the body, where they regulate the function of various organs. The release of hormones from the pituitary gland is controlled by the hypothalamus. The hypothalamus generates releasing and inhibiting factors that act on the pituitary to either stimulate or inhibit the secretion of specific pituitary hormones. The equine pituitary gland is comprised of 3 lobes: the pars distalis, the pars intermedia, and the pars nervosa. The intermediate lobe, or pars intermedia, is affected in PPID. In a healthy horse, the production of hormones from the intermediate lobe is inhibited by dopamine. In the healthy horse, dopamine is released into the intermediate lobe from neurons that originate in the hypothalamus. It then binds specifically to dopamine receptors on the surface of the cells of the intermediate lobe, like a key fitting into a lock. Once the receptor is occupied by dopamine, the receptor acts like a brake, inhibiting the production and release of the hormones from the intermediate lobe. In a healthy horse, there is ample dopamine available to evoke a strong inhibitory action by the dopamine receptor to make sure that just the right amount of ACTH, alpha MSH, and beta endorphin is produced by the intermediate lobe. PPID originates from a degeneration of the hypothalamic dopamine-producing neurons. The lack of sufficient dopamine in the intermediate lobe leads to an increased hormone production. The absence of dopamine allows the cells of the intermediate lobe to divide and enlarge, causing the pituitary gland to increase 2 to 6 times its normal size. As a result, intermediate lobe hormone concentrations in a horse with PPID may be more than 10 times greater than in a healthy horse. The lack of dopamine in horses suffering from PPID can be managed by using Presend. Presend is a dopamine agonist. It acts to replace the dopamine that is missing from the intermediate lobe of the pituitary in horses with PPID. By binding to the dopamine receptor, Presend decreases the secretion of hormones by the intermediate lobe.
Okay, so I cut it off because it's a little bit of an infomercial after that, and it was really about the visual for everybody, but we'll just, sorry. Okay, so we'll just skip ahead now. So it kind of mentioned it a little bit in the video, but we do, when we test these horses for PPID, we test those hormones that they release to see if basically the ACTH is elevated in the bloodstream. And that can also affect their insulin or the glucose. So it's usually what we test for. They're also for horses that are on kind of like are in a gray area or maybe don't have a positive ACTH on their test. Sometimes we recommend doing a stimulation test, a TRH stimulation test. And so basically we inject this hormone to then stimulate the release of ACTH. And if there's an over dramatic response, we would consider that horse to be positive. So again, that video showed you that the FDA approved treatment for this disease is Presend or Pergolide. And this is, it's not a cure. This is something that we use to manage them. It's a lifelong medication once they've been diagnosed with PPID. And our goal is not necessarily always to get the numbers within normal, the blood test to be normal, but it's to improve the horse's clinical signs. So any of those signs that I talked about earlier, if we can get an improvement in that, of course, if we can get the numbers down to normal, that's great as well. But it is something that our biggest goal is to control the clinical signs. The last thing that I wanted to talk about is thermoregulation in geriatrics. So it's just something where horses can have the decreased ability to thermoregulate actually they can become hyperthermic, so hotter with exercise more easily. And this was actually a paper done by Dr. McKeever in 2010, right at Rutgers. So he showed that with exercise in aged horses, they had greater sweat losses and a higher heart rate. So it's just something to consider if you have a horse that is aging and is still in full work, just considering the temperature and all of that and how they recover. Thermoregulation can also be influenced by uncontrolled PPID. So horses that aren't being treated and their numbers are not well controlled, they might not be able to regulate their temperature as well. Also, there's some evidence that BCS, or body condition score of 5 or greater, can provide insulation during the winter months. So more feed increases body heat. There's also a study that was done on water intake. So I have warm water here, increases water consumption with a question mark. So the study was done basically by giving horses access to cold water, warm water, and then 1 bucket of warm and 1 bucket of cold. And what the results of the study were that if they were given a choice, the horses actually preferred to drink cold water, but they would drink less of it. So when they had just the cold water, they would drink it. When they had both, they would actually drink the cold water. But when they only had access to warm water, they actually drank more of a volume of the warm water. So it's a little bit hard to say what your horse would prefer, but if your horse prefers warm water, it is something that you could consider just to increase their water intake. And then my last slide here is just a picture. I just think it's funny. It says, "What happened to you?" and says, "My mom is cold." So it's like, the quintessential horse owner was like, "I'm freezing, so I need to put 7 blankets on my horse." Every horse is different in what they need. And we always get questions about blanketing. What type of blanket should I put on? It depends on the horse. Some horses don't need a blanket. They have a very thick winter coat and they're acclimated to the climate. If a horse isn't acclimated to the climate, maybe has PPID or maybe is losing weight, putting a blanket on them might help them to conserve their body energy, and then therefore potentially gain a little bit of weight. But I just thought this was a cute little cartoon here. And then, so just remember, the digestive system, the dental system, the musculoskeletal system, and the immune system, all of these are important, and all of these can influence how your horse ages and, the success that we have in keeping them happy and comfortable throughout, the aging process. And with that, I just want to open up for any questions. I think Dr. Williams probably has a bunch that she's gathered. So, I'll just stop my screen share here.
Awesome. Yes, I do have a lot of questions. And before I ask them, I do want to say the way I chose these topics for the horse management seminar this year is I went back through 3 years of evaluations of all of our webinars, and I picked basically just a modge podge of some of the most commonly asked topics. And by far, the senior horse and senior horse topics rose to the top. So that's why today we are doing the senior horse. Pasture management was another one. If you missed it, that was last week. Also, health and welfare, parasites, pain management, that's next week. So I've kind of grouped your questions into a few different groups because the first group that came through were a lot on teeth and the EOTRH. Okay. So first with EOTRH, are there certain breeds that it's more common in, and what age do the signs typically start?
Yeah, so we haven't found a specific breed to have it more commonly. I think it would be hard for me to say personally. I don't think research has shown one breed over the other, because I have a very strong performance and warm blood thoroughbred population, so I do see it pretty often, but I can't say that it's more common in any other than any other horse. There has been a little bit of talk of whether it's a regional thing, like whether certain horses in, say, I'm just using this as an example, like Colorado are different than ones in New Jersey. And again, we don't have enough research on this disease to really say, and there are some veterinary dentistry has evolved a lot, so there are people looking at this, but we don't have basically we don't have those answers yet. But I would say that most of the horses that I see in their 20s have some level of clinical signs of this. Some horses never ever show it. But I start to see it. I can even see it in as young as 15. But the horses above 20 are the more consistent ones that I see at least some level of, say, the recession of the gums around the teeth or whatever. As they get even older, that can progress, and I can see the more severe signs. So yeah, I would say over 20.
Interesting. Have you ever heard of it being reversed, or is there a reversal? Because someone mentioned by switching off of grain to a forage-based diet, they feel like they were able to reverse just mild signs of it.
I personally have not, but and again, that's where we feel that there may be somewhat of a either nutritional component to it, or maybe something in the soil that the horses are grazing. We're not sure, but I personally have not had that be successful. But it is, if we could find that fix and that prevention, that would be, that would be the goal, obviously.
Definitely. Awesome. So one more tooth question before we move on to PPID questions, because there was a lot of those. Have you ever seen gum issues from horses eating out of slow hay feeders? So I know those are very, very common for a lot of the heavy old horses. That's an interesting question.
So not necessarily gum issues, but I have seen wearing of the incisors. So the same the same teeth that EOTRH is affected by. I've seen, it's actually very common for me to see that, is basically small areas of wearing in the front teeth. Again, sometimes you have to balance what is for the benefit of the horse. If you have a horse that is obese and you need to control intake of hay, and there's a risk for laminitis or something else, then wearing of the incisors is the lesser of the two evils, right? But it definitely does. I see, especially with those nibble nets where they have the really tiny holes, the horse has to really work to get, them, out of little holes. I do see commonly wearing, and horses that crib, I see even more significant wearing of the incisors.
Awesome. Great. Well, fortunately, we have a little bit more time for questions because there was an awful lot of PPID questions that have come through. I'll try to group some of them, but some of them were talking about Percend particularly. And of course, I have a PPID horse too that I have to manage. And I know they tell you once you pop those little pill packets open that you need to use them. However, the question was, some horses are only on half a tablet. So what do? Do you have to waste the other half, or
yeah. So that was always what the company recommends, right? Because it's FDA approved, to come out of that little blister pack, and the stability the company had always said that the stability of the remainder of the tab could be questionable depending on how long it was out. It used to be like you have to feed it within 20 minutes, and now it seems like it's a little bit less of a concern. And maybe they've done a little bit more research to show that maybe it is stable a little bit longer than they think. But what I recommend with the horses that are on a half a tab is just putting it in basically like tin foil, like wrapping it, and trying to keep it just not exposed to any moisture or the air. And that's typically what I do. And we still have good success with those cases that have to be on a half a tab. I wish they made it in a half a tab formulation, but they would have to go through the FDA approval process again, which takes a long time and a lot of money.
Definitely. Well, along those same lines, because weight can definitely change in the horses when they start on Percend. Would you advise having them run body weights, or even doing body condition score assessments on a regular basis?
I think it's always a good idea to do that in your horse, no matter if they're on Percend or not. The most commonly reported clinical sign of Percend is inappetence. So that is, we even describe it sometimes as like they have like a veil on and they're just a little bit say depressed and it can be short term. So what we do with those horses that we do see that, we usually start them on a normal size horse on one tablet of Percend once a day, and we will decrease that to either a half or even a quarter of a tab, and then try to do that for a few days or maybe even a few weeks depending on the horse, and then increase it back to the recommended dose. And some horses don't tolerate percent in at that dosage. So we have to do, again, we have to work for each individual horse. So, but yes, doing body conditioning scores and weights on your horses, even if it's once a month, that would be great because you can, monitor that. I mean, don't like if they lose 10 pounds, don't like freak out by it, but it's something to see trends, and it would be helpful.
Good to know. So what about some of the ACTH tests? How often is there false negatives or even false positives?
So ACTH is a hormone that can rise when the horses are stressed or in pain. So we typically don't recommend doing testing if they're like in an acute episode of laminitis or something like that, because it can be falsely elevated with that. I usually recommend doing it at least once a year if the horse is on percent, so we can monitor, what their numbers are. There is a elevation, natural rise of ACTH in the body in the fall. So we actually have adjusted our normal ranges in the fall to account for that. So we can test it in the fall, whereas before it was like a little bit, we weren't sure, it wasn't reliable. We now have enough data to know whether a horse is truly positive in the fall or not. So we can test in the spring and the fall, either or. And yeah, I think, it's a good thing to do if you suspect it. And even sometimes as they age, it might be a good thing just to check, just to make sure what your horse's status is.
So even if horses are already on the percent, do you recommend rechecking as well?
So yeah, we recheck them, some horses every 6 months and some once a year. But we're just monitoring that at that point response to medication. So if the horse's ACTH starts at 600 and normal is less than 40, then I can retest it after the horse has been on percent, say for 2 or 3 months, and see those numbers trend down to say more of a normal number, or sometimes they can go back completely to normal.
Nice. Well, I've got one more for you that's a little more general, and then I'm definitely going to ask, I know I asked Dr. Martin earlier, there's an awful lot more questions on there, especially about PPID. She did say she would stay and look at some of those questions and answer some while we move on to the next speaker. But your last question I have for you, and I think this is a really good one for all horse owners and in general, but specifically senior horse owners. Do you recommend doing annual veterinary exams, especially like lameness or blood work and things like that, once they become senior? And what would you really consider senior?
Yeah, I mean, so I guess it's hard to say. We don't have a defined age in the horse where it's like this is a senior, and geriatric healthcare has gotten even older and older over time. Like we have horses living up almost to 40 at this point and in their late 30s. I do think it's important for your horse to get an exam every year, no matter what their age is. And usually that happens at the time of vaccinations or whatever. Same as a small animal, like the small animal world where your dog will come in for just a checkup. It's important to have, your veterinarian like aware of any concerns that you have with your horse, especially because then if we ever are called for, say, an emergency, we know all, what your horse looked like a month ago, or what, any of the issues that you might have had with the horse, going through that time. So I think it's a really important thing. And, during those times where you're having those appointments, ask questions about the nutrition, ask questions about anything that you might be concerned about, because that's your time. That's the time that we are there to help you and guide you.
Awesome. Well, that was fantastic, Dr. Martin. Thank you so much. I know, again, there's quite a few questions left, if you don't mind sticking around.
Yeah.
But I'm sure we're all giving you a big, nice virtual round of applause. So thank you again.
Thank you guys for having me. I'll stick around.
Awesome. So with that being said, we're going to stay on the senior theme today, because I know there's probably a lot more nutrition questions also that are coming up. So I'll ask Dr. Liburt to come live and to start uploading and turning on her screen. And I will go ahead and introduce Dr. Nettie Liburt. Fortunately, we have another Rutgers alum with us today. Yay. So Dr. Liburt is currently an independent equine nutritionist. She owns and operates Liburt Equine Nutrition Consulting. She writes and speaks and consults for clients of all disciplines and backgrounds on matters of equine nutrition and management. She also has a weekly podcast, farm to stable, and I'm sure she'll share information with you about that at the end of her presentation. And she aims to help horse owners and enthusiasts understand basic nutrition concepts and practices from a science-based perspective. She has previously worked at major feed companies where she helped formulate and develop new products, also provided veterinary continuing education, and contributed to the design and implementation of research projects. She holds a master's and PhD degree in animal science with specialization in equine nutrition and exercise from Rutgers University. And she studied with Drs. McKeever and Malinowski, who you heard from in the video earlier. As a result, senior horses hold a special place in her heart. Dr. Liburt is a member of the Equine Science Society and is a registered professional animal scientist. She also happily spoils her semi-retired appendix gelding ET, and she enjoys competing in hunter and equitation divisions where she can. So with that being said, Dr. Liburt, thank you again for joining us, and take it away.
Well, thank you, Dr. Williams. And yes, I'd be remiss to say if I didn't say that Dr. Williams, of course, helped in the completion of said PhD and master's degree. So thank you very much. But yes, thank you again for having me. It's always good to be back and to be with the Rutgers crew. And as Dr. Williams mentioned, yes, the senior horse holds a near and dear place in my heart. This mare in the corner here is also a Rutgers alum. This is Haywin Lee, who lived to be in her very late 20s, but she was one of the excellent equine teachers at Rutgers University, and she was very much loved by all. So we'll get right into it. And Dr. Martin was just talking about this question. When is a horse considered a senior? And the answer is, well, there is no predetermined age. Typically, horses are showing some signs of age by about 20 years. And even if you don't see those signs externally, very often there will be physiological changes, such as some of the endocrine changes that we just heard about. And old for purpose will vary. Typically, you don't see a 15-year-old racehorse, but you might not consider your 15-year-old horse a senior. So that's just for example. So again, here's Haywin Lee again on the left-hand side, and her daughter, Hey I'm Lost, better known as Bonnie. For any Rutgers alum out there, you would know these two girls as well. They were excellent treadmill runners in their day. And why are we all so enthralled with the senior population? Well, one of the reasons is that the population of older horses is growing in the United States. So in 1998, we estimated about 7.4% of horses were over age 20. By 2017, that number had grown to 11.5% over the age of 20. And a new round of demographic data was just published by the American Horse Council, so I haven't updated it with that yet. But the bottom line, we're keeping horses longer, we're keeping them as pets and companions, and the more research that's done, the more we learn about it, and therefore we can care for our horses into their old age a lot better. Excuse me. In addition, we're much better at parasite control now, and instead of, we can target deworm for horses, so we're much better at it. So on that note, it used to be thought that as a horse got older, they naturally had a decrease in their ability to absorb nutrients. And it turns out that that's not true. Age alone does not significantly affect digestive efficiency in healthy horses. And this has been published a couple of times by Dr. Ralston, was a co-author. She's a former professor at Rutgers. So can there be other factors? Yes, but just because a horse gets older doesn't mean they lose digestive efficiency if they're healthy. Now, that said, typically they're not working as hard as they were as they enter their golden years. So they may not need as many calories, but they still need their vitamins, minerals, and their protein. So those needs do not decline in the same way that their need for calories does. So practically speaking, when I'm formulating a ration for an older horse, I want to meet their nutrient requirements from a vitamin mineral perspective as if they were in light work, but their calorie requirements, I'm going to look at making those a little bit less, assuming the horse's weight is stable. Some horses may need supplemental vitamin C, some may not. Typically, if they have been diagnosed with some kind of compromised liver function, we'll recommend vitamin C, but I don't recommend just willy-nilly supplementing vitamin C. And the reason is that the horse has the ability to make their own in their liver, hence the reason about supplementing if they have compromised liver function. And if you supplement it, the body is going to say, oh, I have plenty of this. I don't need to make any more. And then if you remove that supplement, it's going to take the body a little time to catch up. And vitamin C, as we know, is important for immune function. We know immune function declines a little in the aged horse. That is a whole other discussion I'm not going to get into today. But so we don't want to limit the vitamin C that they have available to them. So where are we going to start? You're going to have your veterinarian out. You're going to evaluate the overall health of the horse. Are there any medical concerns, physical concerns? Are there any metabolic issues such as PPID or equine metabolic syndrome, which I'll talk about more in a moment? And current weight. This is something I encourage all horse owners to do in some way, shape, or form. Estimate your horse's weight. And one way to do that is with a weight tape, as shown in this photograph here. And you'll notice that in front, the horse is standing square and the person has the weight tape just behind the shoulders on both sides. And that is kind of the best way to do it. The horse's neck is sort of in a neutral position, so that's helpful too. Body condition scoring, as Dr. Martin talked about earlier, there are lots of resources on the ESC website and charts that you can look at. And the only way to get used to doing it is to actually do it. So if you feel your horse's ribs pretty easily, but you don't see them, for example, you might be okay. But if you don't find ribs at all, you're like, uh-oh, you might be a little overweight. If you can see those ribs from a mile away, chances are that horse needs some groceries. A scale, if available, if you're lucky enough to have access to one. And this app, it's called the Healthy Horse app. I think it's about $1.99 as I speak to you right now, and it is worth that $1.99. This was developed by our colleagues at the University of Minnesota and the University of Kentucky with some corporate sponsorship as well. And it walks you through it. You choose your breed of horse. It asks you what measurements to take, body length, heart girth, neck circumference, and height. You punch those numbers in, you hit calculate, and it spits out an estimate. In my experience, this has been the best estimator of a horse's weight, even better than a weight tape, better than the calculation. So that's my little plug for the app. We always, with any horse's diet, we're going to start with forage. Pasture, if it's available. In some parts of New Jersey, I live on Long Island, very few people have pasture, so we're very heavily reliant on hay. So it depends on where you are and what your situation is. And if your horse is generally healthy, again, that hay and forage, always the basis of the diet. And many horses can do just fine on hay alone. Typically, we'll recommend a ration balancer, and how much to feed depends on their body weight. And a ration balancer is essentially like a daily vitamin. It's a concentrated source of vitamins, minerals, and protein. That doesn't provide a lot of calories, but it can balance out what may be missing in the hay. But if that's not enough, then we turn to commercial concentrate feeds, if necessary, to help that horse maintain weight. Wait, I think we went too fast. So in general, we can classify aging horses into 4 categories: the young at heart, aged with a tendency to lose weight, aged with a tendency to gain weight, or a geriatric horse with health problems. And we're going to go through each one of these categories and talk about some of the differences. So for the young at heart, a lot of people will say, when do I switch to a senior feed? And you may not need, again, there is no answer for that. It depends on the horse. And there's occasion, well, I'll recommend a senior feed to a 4-year-old horse. It's not about the name of the feed. It is what is in the bag. So if your horse is doing fine on whatever nutritional routine you have, you don't necessarily have to change it just because your horse is a certain age. You may not need to make a change. If the horse is in good health, there's no clinical problems, the horse maintains their weight, they're in good weight, you have a good quality forage, and maybe is tolerating exercise. So it's not necessarily you have to make a change just because your horse turns a certain number of years old. You may need to adjust calories, may need to adjust them down if they're working less. Um, but again, as I mentioned earlier, you don't want to reduce your protein, your minerals, and your vitamins. Now, this is a shameless plug of my own horse. The day after his 23rd birthday, very happily kicking up his heels and showing everybody that, yeah, don't call him a senior just yet. And in fact, he already did attempt to maybe get a little frisky when I was riding once this year. So he's got quite a bit of spunk left. So generally, as I mentioned before, it's important to know your horse's body weight, because if you do speak to a nutritionist, one of the questions we're going to ask you is how much does your horse weigh? Because we will build the diet based on your horse's body weight, among other things. Are there special considerations? Are there health or dental issues that we heard about from Dr. Martin? Is your horse still in work? How is body condition? Is forage alone maintaining weight, or do you need something in addition? So these are just some basic questions to ask for your horse as they go through life and as they enter their older years. So some of the most common other questions I get are, my horse is too thin, my horse is too fat, what do I do? So we're going to get into that. So it's not uncommon for older horses to lose weight or become underweight. And we're going to talk about how you can address that. First, you want to try to figure out what is the primary cause of weight loss. Is the horse able to chew food? Dental exam, very critical, as we just learned. Is the horse under stress from any kind of disease state? And again, your veterinarian is your partner in this. Is there any other pain or medical condition? Is the horse turned out with others that are maybe bullying him? Is he fallen down the totem pole in terms of, who's the big guy in the paddock? Are you noticing any changes in appetite? Any changes in the amount your horse eats? If you throw 3 flakes of hay and they used to clean it up, but now they're leaving half of it, well, that could be an indication that something is wrong. Medications can affect appetite, including Presend, as we just learned. And we used to very often blame parasite scarring on the decreased efficiency of the gastrointestinal tract, but that is much less common now because, as I mentioned, we're much better at parasite control. So thinking about why could my horse be losing weight and trying to figure out that primary cause can be a big help. So again, if your horse is falling in the pecking order, maybe they stop eating and drinking. Environmental temperature changes is a big stressor. Older horses have a harder time maintaining their body temperature in hot or cold weather. And our weather has been so weird lately. I just heard on the news that it may be 60 degrees next week and it's going to be in the 20s tonight. So that's a very big swing that can be stressful to an older horse. Is there pain in their teeth, in their mouth, in their joints, in their neck? Are there changes in their hormone productions? Again, you're going to need your blood work from your veterinarian to help determine this. And some of the effects, as we talked about, could be loss of appetite, loss of body weight, dehydration, which we want to obviously try to avoid, and especially because that puts a horse at high risk of colic. Anytime that horse is reluctant to walk or move, you want to talk to your vet. And any behavioral changes, whether that's under saddle or in the cross ties or out in the field or in their stall, you want to keep tabs on that. So poor dentition, as we learned about, I don't have the cool teeth pictures that Dr. Martin had, but I have the cool nutrition pictures. So in this photo, what you see is what we call a hay quid. And it is simply a wadded up ball of hay that a horse had in her mouth. There's a mare at my barn that quids her hay very badly. She has no teeth left. And you'll see these little balls of matted up hay all over the stall if they're quitting. And very often I've had owners say to me, oh yeah, I see those hay. My horse eats plenty of hay, but yes, I see those hay balls all over the place. So that means your horse is not ingesting that hay. They're taking it in their mouth and maybe playing around with it, but they're not able to chew it and swallow it. So it just ends up on the ground. So in that case, again, your horse may not be consuming as much as you think. If your horse has any kind of bad breath, I love the smell of horse breath, right? It smells sweet like hay. And if it smells bad or rancid, that's a sign that your horse needs some dental attention. Um, Ineffective chewing, leaving feed whole, that's something that we want to look out for. And if your horse cannot properly chew hay, they're not going to produce as much saliva. The more time they chew, the more saliva they produce to help push that hay through the digestive tract and to help buffer the stomach. And other effects of poor teeth can include an increased risk of choke. And if you see excessive fiber length in the feces, that's also a sign that you want to have your vet look at your horse's teeth. So in case you haven't figured it out from this evening, teeth are very important. Now, if your horse does have a problem with teeth and can't chew hay, we can fix that. We call this class of feeds forage alternatives. And it's not that they are not forage, they're just not typical, like not pasture or not hay. I have a friend of mine who had a senior horse and was having problems with colic, and he ended up in the clinic twice inside of about 2 weeks. And she asked me for help with his diet. She said, oh, by the way, his teeth are really bad. So we removed the hay from his diet, replaced it with some senior feed, some soaked hay cubes, and some chopped fiber. And he did fine for the rest of his life. So hay cubes can be Timothy, they can be alfalfa, they can be a mix. Fiber pellets, this might be pelleted hay or hay stretcher. I know we had some questions about that in the Q&A earlier. They can contain things like soy hulls, alfalfa, or oat hulls, but they're in a pellet form. And my personal favorite, beet pulp. I love beet pulp, and it's in the picture on the bottom, and I love the shreds. They soak very quickly. You don't need to soak the shreds for 14 hours. You can soak them for 15 to 20 minutes in tap cool water. And they will be fine. But beet pulp is an excellent fiber source, and the microbes in the hindgut really, really like it. And your horse can get lots of good energy from that. And because the fibers are short, they can often handle it better. If their teeth are less than ideal, then they can actual long stem hay. And of course, I recommend soaking all of these things. Other management tips. We've already talked about dental health, but think about the placement of your feeder. Is it very low? And if it is very low, does your horse have pain in the neck? Does that make it hard for him to eat? So think about putting them around chest height to make it easier for the horse to get. If there are problems in the herd or bullies, remove that horse from the herd or change the herd. Soaking the feed to increase water intake, and then work with your vet to determine any sources of pain. And in these crazy temperature swings, there's not a lot we can do about that, but we can manage a hair coat, we can manage blanketing, we can make sure your horse has shelter from the sun and the freezing cold, and that can also help. So for that hard keeper, how are you going to feed them? Well, we know forage is the first step. Whether it's a forage alternative or whether it's hay. And one way to increase calories is by adding fat to the diet, not sugar, but fat. And the reason is that with a gram of fat, you get about 2.5 times the calories that you do for the same gram of sugar. So that's a big deal. So you could look for a commercial grain concentrate with 8 to 12 or 14% fat. You could add oil or another type of commercial fat supplement. But if you do that, adding a lot of fat means you also want to add a little vitamin E to make sure that vitamin E is an antioxidant, so that can help counter some of the effects of fat digestion. That's Dr. Williams' area of expertise too. Maintaining good quality protein to support muscle mass. And by good quality protein, I mean making sure that essential amino acids are part of the diet. Essential amino acids are those that the horse cannot make in the body. They have to take them in through the diet. Again, adding things like your forage alternatives can be helpful, even supplemental. If your horse has perfectly fine teeth, adding a little bit of beet pulp can be helpful for weight management. So for example, if you're trying to increase your horse's body condition, let's say you want to go up one score from a 4 to a 5. On the average for an adult horse that should be around 1,000 or 1,100 pounds, I want to add about 6,000 calories a day to that horse's diet. So you think, wow, that's a lot of calories. So the average 1,100-pound horse at maintenance needs roughly 20,000 calories a day just to maintain their weight. So adding 6,000 per day is going to help them gain weight over time. It should take a long time. It should take 30 days is fast. 30 to 60 days, even 90 days is a little more realistic for a horse to gain that weight, especially if they're a hard keeper to begin with. But it should be slow. A horse should not gain that kind of weight fast, because you're going to risk some other problems if you do. So typically we're looking for higher fat, lower starch grain concentrates or fat supplement. And again, that range of calories is going to depend on the individual horse, their health, and all that other stuff. I already talked about fat and carbohydrates. So the only thing I'll add to that is we're going to get into carbohydrates and equine metabolic syndrome. But one of the reasons that fat is so highly recommended is because it does not elicit an insulin response. So when you have sugar, your insulin goes up. We know that chronically high levels of insulin can put a horse at risk for laminitis. And if your horse is resistant to that insulin, it's going to mean more and more insulin. So again, I'm going to get into that in a little bit, but fat does not have that effect. So it's a great way to add calories to the diet. So now we're going to go the other way. So what happens if you have a horse that just tends to be an air fern, right? They tend to gain weight or they are obese and you're trying to work on reducing their weight. So for those of you with easy keepers, those horses probably require less calories. They most likely do not need a grain concentrate. They still need a ration balancer and they still need forage, but they probably don't need all the extra fancy grains and oats and whatever else you might be feeding. But it's still important to make sure they have enough forage in their diet and that forage is balanced. So just as with the finding out the cause of weight loss, we also want to try to understand what is the cause of weight gain. And sometimes it's just a matter of a person not understanding how to feed their horse. And if this is you, do not feel bad because there are tons of people out there who are just trying their best to do the right thing. And it just ends up maybe throwing the horse's diet out of balance. So is it a lack of exercise? Can that horse exercise? If yes, great. If no, okay, we can work with that. Are you overfeeding grain? Are there metabolic changes? Has the horse lost muscle? Because just as with you and me, as we get older, horses do tend to lose muscle. It's called sarcopenia. And muscle is metabolically active, as is fat, but muscle burns calories. And so if you have less muscle, you're probably burning less calories if you're just standing around doing nothing. So that can affect overall calorie needs for the diet. So let's say we need to take some weight off a horse. And with the underweight horse, we were adding calories to the diet. With the overweight horse, we're going to reduce calories in the diet. So again, we want to make sure that that weight loss occurs over a period of time, 30, 60 days at minimum. We still need ration balancers. We still need forage, and there's a huge individual variation. So I'm going to get into a little bit of math here. And if you ask anyone who knows me, I was told there'd be no math involved. But I want to just give you a little insight into the thinking behind how we as nutritionists will determine how much to feed your horse. So first, we need to know how much your horse weighs. So let's say that horse is 1,300 pounds. And of course, keep in mind, gut feel may change, but let's just say, for example, that horse is 1,300 pounds. And you want to take 100 pounds off that horse. So to determine how much that horse should have, you're going to say 1.5% of that horse's body weight is what is needed in what we call dry matter. So dry matter is, say, hay with the water removed. Now, you probably don't have the ability to dehydrate hay in your barn. Most of us don't, but we can estimate that. So without a hay analysis, we will use to estimate that. So why am I talking about this dry matter? And the reason is it's a way to compare apples to apples, because if you're comparing two different things and you're not accounting for the water can dilute the nutrient content. So if you take the water out, now you're comparing the same thing. So we're going to take that 1,300 pounds, we're going to find out what 1.5% is, and that equals about 19.5 pounds per day in dry matter. So that's the amount of food, everything included, that horse is going to take in per day. Now, because I said dry matter and we remove the water, we do want to estimate what the water content of, say, that forage is. So we're going to add back 10%. 10% is a reasonable estimate of the moisture content in your hay. You will not know for sure without an analysis, but it's just an estimate. And remember, if you're a little confused by this, don't worry. Again, this is just to give you some background, right? So we're going to add 10% to that dry matter amount. So 19.5 pounds times 10% is an extra 1.95 pounds. You can round up to 2. And we're going to add that together. So 19.5 plus 1.95 is about 21.5 pounds per day. So that's the amount of forage you're going to take off your bale of hay, weigh out, and that's what your horse is going to get in a day. And that forage doesn't need to be the freshest, nicest, leafiest, greenest. It should be more moderate quality. Okay, so I hope you're still with me. So when we go to feed that horse, we talked a little earlier about small hold hay nets or grazing muzzles, and people do always kind of cringe when I recommend a grazing muzzle, but they really do reduce the intake of your horse without preventing them from eating. We're going to decrease or eliminate grain concentrates. Treats may need restriction depending on what you're feeding. I had a woman feeding her horse 3 to 5 pounds of carrots per day. That's a little bit excessive. So we might have to just check that we're not going overboard with the treats. I am the worst. I know my horse yells at me if I don't give him a treat right away when I come to the barn. So you have to just moderate that. When you restrict a diet, you've heard me say a couple times already that it's important to maintain vitamins, minerals, and proteins. And we can do that by providing that ration balancer. So especially when you're restricting intake, you want to make sure your horse gets those nutrients with a ration balancer. They're easy to find. Every major feed company makes one. They're not all exactly the same, but they're typically anywhere from 28 to 32% protein per pound. Do not freak out about that. You're only feeding to an 1,100-pound horse, maybe 1.5 to 2 pounds per day. It's okay, I promise. You're going to weigh and you're going to body condition that horse regularly to monitor for change. And all of that math we did in the last slide to determine how much your horse weighs, you're going to adjust that down every time you weigh your horse. It's more of like a gradual tapering rather than just a hard cutoff of the diet, because we found, research has shown that when you taper down what the horse eats as they lose weight, you get less of a rebound effect, if you will. So again, stay with me and don't worry if you didn't follow all those numbers. It's okay. So we're going to move on to the last category here is the geriatric horse, or the horse with health problems. And I'm going to talk a little more about those endocrine conditions in a moment. PPID is one we've already heard about tonight. You've heard me mention equine metabolic syndrome, which I'll explain. Increased episodes of colic, alterations in cardiovascular function, and this is the culprit behind horses having a harder time regulate their body function, and it's a function of blood circulation in the body. Horses are at increased risk. Older horses are at increased risk for infection because we know there are changes in the immune system as they get older, and potentially a decline in fertility because there are mares having babies into their late teens and early 20s, and potentially could affect stallion performance as well. Now, the two most common equine endocrine disorders are PPID, which we've heard about this evening already, and equine metabolic syndrome. So PPID, while it is most often diagnosed in older horses, horses of any age can be affected, however, so keep that in mind. Equine metabolic syndrome does not discriminate. It can affect horses of any age, any breed. They may be overweight, they may not be overweight. Certain breeds are more susceptible to equine metabolic syndrome. For example, just about all pony breeds, Friesians, some warm bloods, they just tend to be more susceptible to it. And again, those horses may or may not be overweight. I knew an Arabian pony who was fit as a fiddle, perfect body condition, being ridden 5 days a week or more, and horse showing, lessons, old thing, and was really insulin resistant. So they had to make sure that they monitored her diet pretty well. I alluded to this earlier. What is equine metabolic syndrome? It is, if you're familiar with type 2 diabetes in people, it's not exactly the same thing, but most people can sort of understand it. So it means that if a normal response to a meal, your body releases insulin to have sugar stored in your muscles or in your liver so that you have energy for when you need it. If you're insulin resistant, that normal amount of insulin is just not a strong enough signal. So the body compensates by secreting more and more insulin in response to the intake of starch and sugars. And as I mentioned earlier, high levels of insulin we know can induce laminitis. So it's something we want to be very careful about. So if there are metabolic concerns, and by metabolic, I mean equine metabolic syndrome or EMS or PPID, hay and forage is still the basis of the diet, but you may need to soak your hay to reduce the amount of starch and sugar in it. I have a friend at the barn, and she has a 10-year-old with PPID. I think she's actually listening to this talk now. And he needs his hay soaked. He is insulin resistant and it's soaked every day. And it's really hard to get an analysis because, for example, at a boarding barn, they may be turning over hay every couple of weeks, even weekly. And by the time you get your analysis back, you're going to be on to a different load of hay. Yes, even if it is the same producer from the same field from blah, 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 it can still vary. So in that case, we can soak the hay to reduce some starch and sugar. Typically going to avoid legumes such as alfalfa. Now, alfalfa is not evil, but it does tend to be higher in energy than your grass hay. So we'll typically steer away from it. If that's all you have available, we can work with it, don't worry. But again, we'll typically steer away from it. If your horse has access to pasture, definitely want to have that grazing muzzle. I know I've said it a bunch of times, but I'll say it again. The ration balancer probably needed here based on a horse's body weight. So if they're not consuming any concentrate, did I say it before? I think I did. Vitamins, minerals, protein, they still have those needs. And we can use fat if weight is needed, because you can have a skinny horse that is insulin resistant. And if you need to put weight on that horse, you got to have a way to do it without risking that high insulin response. So if you are feeding a concentrate, you should look for one with low NSC or non-structural carbohydrates. It's a fancy way of saying starch and sugar. Now you might be asking, well, what is low NSC? Well, the answer is scientifically, we don't know. That work is going on. We are trying to determine it, but most equine nutritionists will consider anything below about 12% per pound low, anywhere from 13 up to maybe 19 or 20, sort of moderate, and then the low 20s, and that percentage, again, a little moderate, not quite high yet, but a little high moderate. So again, if you're thinking, oh my goodness, there's so much to think about. No, it's okay. That's why there are equine nutritionists in the world. That's why we can help you. So if we're, some more numbers here. If you have a severely insulin resistant horse, we're going to restrict, suffice to say, we're just going to restrict those carbohydrates per meal, much more so than if you have a horse that is not as severe or is not insulin dysregulating. I won't go into this in too much detail, but some studies have been done to show that horses who are very sensitive to starch and sugar may need to have just even more limits. And how do you limit? you may need to just feed multiple small meals throughout the day of low carbohydrate feed stuff. So there's ways to do it. So again, I won't get into those numbers too much. So overall considerations for feeding those PPID or EMS horses. And while these, let me just say that while these two endocrinological conditions are different, the nutritional recommendations are often the same. The reason is that if you have a horse who is PPID, who has PPID, they are at risk for also having equine metabolic syndrome. But that said, just because they have PPID does not mean they also have EMS, or vice versa. If they have EMS, doesn't necessarily mean they're PPID. They are separate conditions. But because we are concerned about the amount of carbohydrates in the diet, generally to date, the feeding recommendations are similar. So we always start with hay, try to stick with grass hay, soak it if you don't have an analysis or you don't know the carbohydrate content of your hay, then you got to drain it and then you can feed it. Controlling starch and sugar in the diet, using multiple small meals, a grazing muzzle, supplementing fat if you need it, and that quality protein from a ration balancer. It'll also help support muscle even as the horse ages. So, in summary, every horse is different. Each horse's needs, each horse is an individual. So you have to kind of think about that holistic approach. Health, environment, nutrition, all of these things together. And hopefully these tips and guides help you out a little bit. So we're here to help you design diet plans. And I do have to say, this is Molly and Lisa, two other Rutgers alum. You may recognize that field and that run-in shed out there. So two other mayors who were very helpful to me in my graduate studies. Can't forget about the horses, right? That's why we're here. Always start with forage. Target nutrition to the horse's needs. Ration balancers, oil is needed, carbohydrate control if needed, and using your veterinarian's expertise to help monitor insulin response. There is something called a oral sugar test, which if you may have had one yourself, a glucose tolerance test is another name for it. And you can basically give your horse a meal. Well, you take a blood test, you feed your horse a meal, 60 minutes later, you take another blood test, and then another blood test 30 minutes later, and your veterinarian can then measure the sugar and insulin in your horse's blood, and you can see if that meal is appropriate. Now, that's kind of a long day, or at least a long bit of a test, but it is possible. And don't forget that the horse's needs are going to change through life. It's going to change with activity and health status. My horse that you saw bucking in an earlier slide, I don't know where this horse used to put feed. He would eat 6 to 8 pounds of a high-fat feed per day and beet pulp and hay, and I could barely keep weight on him. And now in his older years, he gets a ration balancer, a small amount of a high-fat concentrate, and knock on wood, he's doing just fine. So it really is different, and you just have to keep an eye on it. Thank you so much for attending this evening. I hope you've enjoyed it. I hope you learned something. If you're interested in tuning into a podcast, I do have one. I just try to make it easy, make nutrition a little simpler for everybody to understand. And if there's a topic or something you want to hear about, you can send me an email. Dr. Williams, I wonder if there are any questions.
Oh yeah, you know it. Lots of questions. Before we get to the questions, I just want to mention, since we have some people starting to drop off the call, I'm going to ask Kyle to go ahead and drop the information for our survey in the chat box, please. We would love to hear from everybody. And again, if you want to hear more great topics next year, you have to tell me what you want to hear. So even if you filled out the evaluation for last week, it's a different evaluation for this week. You don't have to go ahead and fill in all your preferences and comments, but we'd love to hear what you thought about today's speakers. So please go ahead and fill out just a really quick survey. But Dr. Liburt allowed plenty of time for questions, and we definitely have those. So let me start with a couple of them that are definitely on the area of the NSC sugars and starches. So let's stay there for a moment, shall we? I tried to answer some of them, and I figured, you know what, let's bounce some questions off of you as well and see what you have to say. So you did mention about the levels of sugars and starches. Would you recommend anything different if the horse was underweight, or would they be the same recommendations? And then kind of in the same thing, what are your feel of beet pulp? What's your feeling on beet pulp?
Oh, I love beet pulp. It was a joke in my office because every time we were developing a new product, I'm like, let's put beet pulp in it. And they're like, yeah, okay, whatever, Nettie. But I always won. So yes. All right. So let me start with beet pulp because that's the easier question. Beet pulp is a byproduct of the sugar beet industry. So just because you hear that word sugar, the beet pulp is what's left over after they take all the sugar out. But the pulp itself is an excellent source of digestible fiber, and it is very low in starch and sugar, like less than 10%. Even the ones that say that have molasses in it, typically very low in starch and sugar. So if you have a real fussy one, sometimes that can help. So love beet pulp for just about anything. And yes, my horse gets beet pulp at lunch, and he will yell at you if you are a minute late with it. So as for low starch and sugar, so if you have a horse that needs to gain weight, you still need to keep that starch and sugar low in the total diet. And one of the ways you can minimize how much starch and sugar your horse takes in is to make the meals smaller. Now, I understand this can be a little bit labor intensive, but if you board your horse, most barn staff are around for lunch or even a night check, and those are easy times without inconveniencing barn staff too much, where you can add in a third meal. If you can do 4, that's even better. And of course, soaking hay, as I mentioned. Now, Dairy One or Equine Analytical is an excellent lab upstate New York where you can send a forage sample to. But it's not always practical to do it. If your horse is at home, maybe you're only buying a few bales of hay and you're buying those few bales every week. It's just not worth doing the analysis. So if you don't know, you can soak it. Soak it, but you have to submerge it and let it sit. And then you got to drain it and then feed it. So those are ways that you can just reduce that starch and sugar and then feed your horse, that soaked hay throughout the day. I hope that answers your question.
I think it did, but also it brought up a couple others that I was already going to ask you. So one was on soaking hay. So you mentioned you can soak it and then feed little bits throughout the day. So the question basically was, how long can you wait before you have to feed it? Like, is there any risk of mold or fermentation or all that sort of thing?
Yes, there is. This time of year, it's less because, of course, the temperatures are lower. There's a lot of answers to this question. In general, if you have tap cool water, now in January, that's probably going to be a little cooler than it is in, say, July. The colder the water, the longer you need to soak it. If it's tap cool, typically the recommendation is about 45 minutes to let that hay soak. And remember, it has to be submerged. You can't just hose it off with the hose. It's got to be submerged. If the water is cold, like it is now out of the tap, and you don't have access to hot water, you might have to soak it longer, 2 hours perhaps. And again, if it's warmer water, you can probably do a little less, maybe 30 minutes or something like that. So I know they hate it when they're in Minnesota and I say you have to soak hay. They're like, no, I understand. I'm sorry.
Definitely. So kind of along the same lines of feeding a metabolic horse, is there any downside to feeding a healthy horse the same diet, other than maybe cost or inconvenience? But can healthy horses also have this low sugar and everything you've been talking about as well?
Potentially, yes. I was at a conference about a week and a half ago that addressed this issue. So if you have a performance horse and you are feeding an extremely low starch and sugar diet, they may not be recovering as well as you want. So if we're talking, again, we're talking about a show horse, or maybe you're going to a multi-day horse show. And if that horse is on a very low carbohydrate diet, their muscles may not be putting the glycogen or stored starch and sugar back into storage as efficiently as they would be if they had a little more moderate starch and sugar intake. So in general, if you have your pleasure horse, you're not in heavy competition, you're not lessening, you're not working very hard, it's probably okay. But if you have a performance horse and you're really looking for peak performance, probably don't want to restrict carbohydrates as severely as you would in a metabolic horse. Now, you may have a metabolic performance horse, in which case
Those are fun.
it is more important to restrict those carbs. You just might have to give that horse, if you're showing, you might want to take into consideration that maybe 2 days in a row is enough. By that third day, you may see performance changes. You may not. It depends on the horse, but it's something to keep an eye on.
Would feeding a healthy horse this diet possibly prevent any problems in the future? Has there ever been any research on that?
Oh, that's the million-dollar question.
Wow.
You know that. Probably not prevent it. We can't prevent PPID with nutrition. We'll just start right there. For example, metabolic syndrome, you can not necessarily prevent it, but you can reduce the risk by keeping your horse at a healthy weight and by keeping them active. And again, an older horse may have some of the arthritis conditions that Dr. Martin talked about that prevents them from doing a ton of work. And that's okay. If they can handle a walking trail ride, do it. That counts. It really does. Turnout does count. So keeping your horse moving, keeping muscle tone to the best of your ability and the horse's condition, do help lower the risk of equine metabolic syndrome. But I can't promise you that it'll prevent it completely.
What about supplements? My favorite
Oh,
topic.
that's your question.
Is there any that helps or are designed to control insulin?
Okay.
Or the insulin dysregulation, I should say.
Yeah. There are
I can chime in too on that one, but I'll let you take it first.
I'll just say there's very little scientific research on things like magnesium, chromium, cinnamon, turmeric. And what is out there has not been done in horses. We don't know dose. We don't know long term how, does it matter long term, short term? Please feel free to fill in the blanks, Dr. Williams.
That's my answer. Yep. Yeah, they're really, the supplement market is very hard to do research on because the ones that want to fund it are the supplement companies. And if it doesn't work, they don't want to fund it. And if they're already making money selling their product, great. So they tend to not do a whole lot of research on their products. So you really need to look for the good companies, the companies out there that are doing the research. And there are companies out there that are. You'll pay a lot of money for their supplements. But you're also getting a very good product. So.
And also, there's no FDA regulation of supplements. So theoretically, they can tell you anything they want about what's in that package, and it doesn't necessarily have to be there. So if you see this little yellow symbol that says NASC, it's not a guarantee of efficacy of the supplement, but it is a guarantee that what the label says is in that jar is actually in there. So again, doesn't guarantee it works, but it guarantees that what they say is in there is in there. And they have to prove that.
So we could probably talk for another hour on PPID and feeding these horses. I'm going to ask one more question. And actually, it's been asked 3 times already. I have answered it several times, but it keeps getting asked. So I want you to address it. And then I might debate with you depending on your answer, if you don't mind. You mentioned no alfalfa for PPID horses.
Oh, all right.
Can you explain what you meant by that? And why?
It's not a deal breaker. The preference is to feed more of a grass hay. And the reason is because alfalfa tends to be higher in energy and calories. It tends to be a little richer in starch and sugar. Now, it is not always. I have seen plenty of analyses of beautiful alfalfa hay that is what I consider low or moderate in starch and sugar that would be okay to feed to a metabolic horse under certain conditions. So that's sort of a general statement. And it's not, and again, if you go out to say Arizona, that's kind of their only forage source is alfalfa. So you need to be able to work with that. And again, you can soak that alfalfa and remove carbohydrates just as you can with any other type of grass hay. So it's not necessarily that you can't feed it. It's that if you can reduce or eliminate it, typically that's the recommendation. But I know it's not always possible in every case. Feel free to
And
debate.
well, that was basically my answer is it's not good to feed unlimited alfalfa.
Right.
So you really need to control the alfalfa.
Yeah.
If you're going to start it, you need to start it very slowly, even slower in some horses than you would others.
Yep.
But my feel is if into the sugar and the starch comment, alfalfa is a legume, and legumes actually cannot accumulate sugar. They can accumulate more starch, so the starch might be higher, but typically the sugars, and I'm talking like, I've seen grass hays that can be 20, 30%, WSC. Alfalfa will never get that high, ever.
Right.
It just doesn't have the same photosynthetic mechanisms to do that, so it's going to be lower. However, I have seen a lot of grass hays which are down around 5% sugar, and in that case, yeah, you might see some alfalfa hays that are going to be a little bit higher
Yeah.
than that.
Exactly.
But yes, the calories are always going to be higher in alfalfa than they will in grass hay. So I think that's definitely.
And the protein is typically much higher in alfalfa than it is in grass. So alfalfa has a lot of benefits. We recommend it a lot too for horses that suffer from equine gastric ulcer syndrome because it's a really good buffer for the stomach. So it's, again, I am not anti-alfalfa at all. I'm really not, but it really depends on that horse's situation, the type and the quality of the alfalfa that you're feeding and all of the things. So unfortunately, it's not black and white.
Actually, something that I have changed within the last year, because I just heard this brand new research, is a lot of the metabolic and insulin dysregulated horses, you really need to be careful of the protein. And I was always preached, it's not the protein. However, out of the University of Kentucky, they have shown that even some of the really high protein ration balancers are starting to cause problems with some of these insulin dysregulated horses. And they did find that it really was protein that was the culprit. So,
we've talked to Dr. Adams a lot about this stuff.
Yeah, that's a whole new area, and it's very interesting. So,
and there's
feed companies need low protein balancers. I think that's the end of this.
Well, and they are out there, but there's some question as to whether or not it really was the protein or was it something else in what they were feeding. And I will say that same lab, that's Dr. Amanda Adams, who I've known since my Rutgers days. She's amazing. They are actually working on for lack of a better term, like a titration study, like trying to see what is that level that's the tipping point. And of course, it's going to be different in every horse, but she has all of the insulin dysregulating, the PPID, the non-insulin dysregulating, like she's got them all. So she has that ability to do that research, but that is coming, and that work into how much, what's the tipping point? Is it too much protein really? I'm not sold on that, but it's still a reason to be cautious. Absolutely. And we know the starch and sugar thing, so we at least have that. But yes,
we do.
Again, even the ration balancer, you can break that up, even though it's only a pound or so, you can break that up into small meals as well, and like reduce the risk of any effect of that.
So I'm saving the last question until after I make this statement. And this last question is not PPID related, so I've saved it for the end. So one last time, please, Kyle, just put in the chat the link. And also I'm going to quickly, and I just did something wrong. I'm going to quickly share my screen one more time and say, please reach out to the Equine Science Center for any questions you might have on the website. Consider donating. And there, if you don't want to type a link, you can go ahead with your smartphone and use the QR code to get back to that survey. Please tell us what you thought. But without further ado, here's the last question, and I love this question. What about helping a senior horse's top line, who has started to use a lot of the top line and a lot of muscle, possibly due to injury or just to old age? What do you recommend if they can't keep up enough exercise to help out?
I will say that nutrition is only half the equation, but it's still a very important half. You need to provide those nutritional building blocks for muscles to be able to do their job. And you need to, there's a lot of work also at the University of Kentucky. Dr. Urschel does this, looking at what are the specific amino acids. Can we turn up muscle synthesis? We're not quite there yet, but we do know that providing that balanced diet, a good ration balancer, can help at least support that muscle development. If your horse cannot exercise in the formal manner, like under saddle or whatever the case may be, turnout counts. Any natural motion that the horse can have will count, especially if they cannot be ridden. If they can be ridden, it's to their ability level. And you can do things like the carrot stretches if arthritis or pain is not an issue in their neck. Dr. Hillary Clayton has a really good book, a couple of really good books about that. In fact, I have to go buy one myself. Some of the carrot stretches and some of the pelvic tucks that you can get them to do will help them engage their core and stretch those muscles. And it can be helpful. I hope that helps.
Awesome. Well, there's definitely more questions I didn't get to. I do apologize, but Dr. Liburt did provide her email. I'm not going to say email her because I'm sure you get inundated, but hey, you provided your email. So if you did enjoy what you heard and you wanted to reach out for anything else, please let her know. Please, I hope to see you next week. We're going to hear all about parasites and ticks and evaluating pain in your horse. So I hope to see you next week. Please fill out the evaluation. And I want to thank both of my speakers very, very much. This was a great day on the senior horses. And yeah, take care of your old boys and girls, because they definitely have a big place in everybody's hearts. So thank you again, guys, and take care, everybody. Have a good night.
Thank you, Dr. Williams. Thank you, Kyle.
Thank you.